Hi, my name is Natalia and I'm an occupational therapy student. For the past 3 months, I've had my clinical rotation or my level 2 fieldwork at the lymphedema clinic. I'm by no means an expert and I'm not certified in lymphedema therapy. However, I have seen a need for some at-home instruction, which I hope that this video can help people with a lymphedema diagnosis who are trying to better manage their condition at home. So today we're going to be going over manual lymphatic drainage massage of the left upper extremity and left upper quadrant. We'll go over a few important reminders or tips first to make sure that our technique is good so that we're actually doing what we need the massage to do. So the first tip I'd like to go over is that for the purposes of this video, I'm sitting, but at your home, this massage would be best if you were laying in a bed or laying reclined in a recliner chair. This is because you want the lymph nodes and the lymphatic system to be open, and also it's just more comfortable to do so in a laying down or reclined position. So another tip that I would like to share with you is that while you're doing the massage, you want as much contact with your hand to the skin of where you're massaging. So for example, when I'm placing my hand here, my fingers are closed, they're not open, they're closed, and I'm applying light to firm pressure in this area. I'm at home, you might want to be undressed if that's possible, or you could wear a sports bra or something to lightly cover, but you really want skin-to-skin contact, as this is really the best way to promote movement of fluid in your lymphatic system. Another important tip that goes along with keeping as much skin-to-skin contact as possible and movement within the lymphatic system is, as I'm doing the massage, I'm going to be placing my hand here and massaging this with the skin moving with my hand. I don't want my hand to be gliding over the skin or sliding, because that's not going to move lymphatic fluid. And this, however, with your hand moving your tissue, that will. So this is the correct form, correct technique to use to move lymphatic fluid within your system. So again, my hand is closed, it's completely on the skin, and I'm using it to move the tissue underneath my hand and not sliding. Something that goes along with that is that you don't want to use any lotions or oils, as that could cause the gliding effect and it wouldn't get the results that we wanted to get. So our important thing to know about your lymphatic system is that you have hot spots of lymph node areas in your body. So these include the neck, the head, your axillary, your armpit region, and your hips or your groins, as well as your abdominal section of your body. So with that said, your abdomen is going to have a lot of lymph nodes, so we'll be doing deep breathing to stimulate those within the massage, and I'll kind of run through that with you. This video is meant to be a follow along video, so you can follow along and do your massage at the same time. You can also just skip to parts if you're confused about something or a technique, and it should just be a resource for you to follow along. Of course, you should always reach out to your certified lymphedema therapist or your doctor to make sure that you're getting the best possible advice that's specific to you and your case, as everyone is different. So we can get started with the massage. The first part of the massage is to start circles at the neck. So I'm going to use my right hand to be on my left side of my neck, kind of near my collarbone / upper chest area. And I'm going to move the circles inwards towards my heart. And you're going to do about 10 of these. 5, 6, 7, 8, 9, 10. Something important to recognize is that it's not always as important to have 10 repetitions as it is the direction of where the circles are going. So we'd rather you do about 5 to 10 repetitions. If you lose track or count, that's fine. But we want to make sure that you're always going in the right direction and we're not pushing fluid into an affected extremity or affected lymph nodes, because they're not going to process that well. So I'm going in towards the heart here, and we did about 10. So now we're going to switch. I can use my left hand to do this side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The next part is going to be the deep breathing. You can place both of your hands on your belly. And the trick to this is to breathe in through your nose and out through your mouth. So when you're breathing in through your nose, as if you're smelling the roses, you're allowing your belly to expand with air. When you breathe out through your mouth, you're allowing your belly to collapse or fall. So we're going to do about 10 deep breaths. You can use your hands here to apply a little bit of pressure as you're breathing. Five more. And that's 10. So for this next part, I will remove my sweater as it'll be easier to see. So for this next part, we're trying to move the fluid to the next closest, healthiest lymph nodes. So we're going from the left to the right lymph nodes and the left to the left hip lymph nodes. Those are our main spots that we're going towards. So for the next part, we want to wake up our lymph nodes in our right armpit. So I'm going to take my left hand and I'm just going to do some circles in this armpit to wake up these lymph nodes and stimulate them so that they're ready for the fluid to move over. And you can do about 5 to 10 of these. Okay, so after we've done that, our next part is to push this and clear this fluid that's already sitting in this lymph node area. We're going to push it across the chest to the right lymph nodes that are healthy. So we're going to do circular motions, or if it's difficult for you to go with the circles, I'll show you a different way. So the first way is to do the circles across your chest. So I'm using my right hand and I'm circling, and then I'm lifting. I'm not gliding, I'm moving the tissue. As I get to this side, it can be a little bit difficult, so I can use my left hand to help push everything over. And I'm gonna go across my chest about 5 times doing this to really clear everything out. This is the 3rd time, and I'll show you the other way. So another way you can do this if the circles are hard is to just press and lift, press and lift, press and lift, press and lift across the chest. So this is going to be my 5th one, and then we can move on to the very next step. The next step is to be waking up your left hip lymph nodes. So this left hip, the lymph nodes are right where you think that your underwear line would go if you're a woman, or when you sit, it's right where that crease is in between your thigh and your hip or abdomen area. So I'm going to press my hand right into this area, and I'm going to go upwards in upward circles. And this is just waking up these lymph nodes. You can do about 5 to 10 of these. Okay, so once we've woken those up, our next step would be, if you have a partner, this is where you'd lie on your side and your partner can do circles down your side towards your hip and across your back towards the right side of your back. But if you do not have a partner, that's totally fine. We can move on and you can skip this step. So if you don't have a partner, the next step would be, after we open up these left lymph nodes at your hip, you're going to move the fluid from up here by your armpit down towards the hip. So if you can see, I'm doing circular motions in a downward direction. And I'm going to do about 5 or 10 of these to move across, to move down. And if it's easier for you, you can do this, but I'm always going down towards that hip. Okay, so after we've done that, we can kind of do some of the breast fluid, the breast edema. So we're gonna massage the breast and we're gonna move the fluid towards the outside of the breast. So I'm moving the fluid towards the outside of the breast and I'm going down at the same time. And after I do that, I wanna go move this fluid that I just moved out of the breast downwards towards the hip. And I can do about 5 of those. Again, whatever way is most comfortable. You can use your left hand, you can use your right hand. Just make sure that you're going in a downwards direction towards the hip. Okay, after we've moved our fluid down and we've already moved our fluid across, we can start to focus on the upper extremity. So you're gonna start at your shoulder doing circles in towards the heart again. So we're gonna do about 10 of these. 3, 4, 5, 6, 7, 8, 9, and 10. After we've done the shoulder, we can start on the arm. So the first part of the arm is going to be going from the elbow up to the shoulder. You want to be focused on bringing the fluid up and out towards the outside part of your shoulder. So I'm going to be doing circles up this in part of my arm. So I'm going to be doing, we can do this in sections. So this part of your arm is going to be one section and the back part of your arm is going to be the second section. You can, if you have smaller hands or you have shorter fingers or you just feel like you're not getting enough coverage, you can do 3 strips. You could do 1, 2, and then do the inside of your arm as 3. Whatever you feel like gets the most coverage and you get the most out of. So we'll start with this by moving up, and I'm not sliding, I'm bringing my hand up in between each circle. And I'm gonna do about 5 of these. So this is 4, and this is 5. And then we'll switch to the back part of the arm. So I'm going to turn my arm and I'm going to do the back side. That's 1. That's 2. That's 3. That's 4. And this is 5. Okay, so now that we've done this upper part of the arm, we're gonna do your lower part or your forearm. So you're gonna go from your wrist to your elbow on both sides. So we'll start with this inner arm first. And again, I'm just doing my circles up my arm. I'm not dragging my hand across my skin. I am just moving the tissue along with my hand in the circular motion upwards. And you're gonna do about 5 of these. This is 4. And this is 5. And then I'm gonna flip and do this side. So 1, going from the wrist up, 2, 3, 4, and 5. Okay, so now I've gone up here, I've moved the fluid to here again. I need to go back up this way to push the fluid out, and I'm gonna do about 5 of these on the front part of my arm and 5 on the back. So that's 2, this is 3, 4, and 5. And then I'm gonna go to the back. 1, 2, 3, 4, and 5. So after we get up here, we can do shoulder circles again. We're gonna go across the chest again with our circles, about 5 times again. 2, and I'm gonna use my left hand to make it easier. 3, 4, and 5. And then after we do this across, we're gonna go down the side again, just like we did before. So this is 1, 2, 3, 4, and 5. So that's 5 down and 5 across here. And the last step is to do our deep breathing again. So we're gonna do about 10 deep breaths. Again, in through your nose, let your belly expand. Out through your mouth, let your belly fall. Five more. and that's 10. So that's the end of your self MLD massage of the left upper extremity, left upper quadrant. I really hope you enjoyed today's video and that you found it easy to follow along. Please, if you have any suggestions or concerns, put them in the comments below. And I hope you have a great rest of your day.